Vitamin E plays the role of an antioxidant, preventing free radical damage to specific fats in the body that are critical for your health and naturally slow aging. Other vitamin E benefits include its role as an important fat-soluble vitamin that's required for the proper functioning of many organs, enzymatic activities, and neurological processes. Benefits of consuming more vitamin E-rich foods can include treating and preventing diseases of the heart and the blood vessels, such as chest pain, high blood pressure, and blocked or hardened arteries. It's found in plant foods, including certain oils, nuts, grains, fruits, and wheat germ. It's also available as a supplement. Cholesterol is a naturally occurring substance made by the liver and is required by the body for the proper functioning of your cells, nerves, and hormones. When cholesterol levels are in their natural state, they're balanced, normal, and healthy. When cholesterol oxidizes, it becomes dangerous. Studies have shown that certain isomers of vitamin E serve as protective antioxidants that fight cholesterol oxidation. This is because they can fight free radical damage in your body, which leads to the cholesterol being oxidized. Tocotrienol isomers of vitamin E have 3 double bonds, and they positively impact cardiovascular health due to their ability to reduce the activity of an enzyme that controls cholesterol production and synthesis called HMG-CoA reductase. Tocotrienol isomers can also prevent cell adhesion and therefore slow down the progression of atherosclerosis or hardening and thickening of the arteries. It's important to note synthetic vitamin E doesn't seem to have the same benefits as the natural forms. Too much alpha tocopherol can actually interfere with the cholesterol-lowering action of delta and gamma tocotrienols, which are two of the most bioactive tocotrienols and types that are linked to cardioprotective activities. Free radicals fight and break down the healthy cells in your body, and this can lead to heart disease and cancer. These molecules form naturally in your body, and they can cause severe damage when they accelerate or oxidize. Certain isomers of vitamin E have powerful antioxidant abilities that have the power to reduce free radical damage, fight inflammation, and therefore help to naturally slow aging in your cells and fight off health issues like heart disease. Studies have shown that this can significantly increase immunity, therefore helping to prevent both common illnesses and serious conditions from forming. Recent research suggests that for immune enhancement and antioxidant effects, the isomers alpha tocotrienol, gamma tocotrienol, and to a lesser degree delta tocotrienol seem to be the most effective. Vitamin E benefits skin by strengthening the capillary walls and improving moisture and elasticity, acting as a natural anti-aging nutrient within the body. Studies have shown that vitamin E reduces inflammation both within your body and on your skin, helping to maintain healthy, youthful skin. These antioxidant properties are also helpful when you're exposed to cigarette smoke or ultraviolet rays from sunlight, protecting against skin cancer. Taking vitamin E with vitamin C fights skin inflammation after exposure to UV radiation, and it can also be useful in decreasing signs of acne and eczema. It also helps in the healing process in the skin. It's absorbed by the epidermis layer of the skin and can be used to treat sunburn, which is one of the leading causes of skin cancer, among other factors. Because it speeds up cell regeneration, it can be used to treat scars, acne, and wrinkles. This makes your skin look healthier and younger. Because vitamin E is a powerful antioxidant, it helps decrease environmental damage to your hair. It can also promote circulation to the scalp. Vitamin E oil can retain the natural moisture in your skin, which helps your scalp from becoming dry and flaky. It also makes your hair look healthier and fresher. You can apply a few drops of vitamin E on your hair, especially if it looks dry and dull. Vitamin E plays a crucial role in balancing your endocrine and nervous system, naturally working to balance hormones. Symptoms of a hormonal imbalance can include PMS, weight gain, allergies, urinary tract infection, changes in the skin, anxiety, and fatigue. By keeping your hormones in balance, you find it easier to maintain a healthy weight, keep a regular menstrual cycle, and find yourself feeling more energetic. Taking a vitamin E supplement 2 to 3 days before and 2 to 3 days after a menstrual cycle can reduce cramping, anxiety, and cravings and other PMS symptoms. Vitamin E can decrease pain severity and duration, and it can reduce menstrual blood loss. It does this by balancing your hormones naturally, and it helps keep your menstrual cycle regulated. Vitamin E may help decrease the risk of age-related macular degeneration, which is a common cause of blindness. Keep in mind, in order for vitamin E to be effective for vision, it must also be consumed with adequate intake of vitamin C, beta-carotene, and zinc. It's also been found that high intake of vitamin E and vitamin A seems to improve healing and vision in people undergoing laser eye surgery. Research shows that the anti-inflammatory activity of the tocotrienols contribute to their protection against Alzheimer's disease. Vitamin E may slow down the worsening of memory loss and functional decline in people with moderately severe Alzheimer's disease or other neurodegenerative disorders. It may also delay the loss of independence and the need for a caregiver or assistance. Vitamin E taken with vitamin C can also decrease the risk of developing several forms of dementia. Vitamin E is sometimes used to lessen the harmful effects of medical treatments like radiation and dialysis for treating cancer. This is because its powerful antioxidants fight off free radicals in the body. It's also used to reduce unwanted side effects of drugs that may cause hair loss or lung damage. Certain isomers of vitamin E have been tied to cancer protection. Several animal studies have found evidence of suppression of tumor growth using oral doses of tocotrienols. While there's more to learn about how exactly this works, several mechanisms of actions are thought to be responsible. Tocotrienols induce cancer cell death, turning off genes tied to cancer, and they inhibit angiogenesis, or the abnormal growth of blood vessels inside a tumor. In animal studies, cancer protective abilities have been demonstrated in cases of breast, prostate, hepatic, and skin cancer. Vitamin E can be used to improve your physical performance. It can increase your energy and reduce the level of oxidative stress on your muscles after you exercise. Vitamin E can also improve your muscle strength. It eliminates fatigue by promoting blood circulation, and it can also strengthen your capillary walls and nourish your cells. Vitamin E is critical during pregnancy and for proper development in infants and children because it protects critical fatty acids and helps control inflammation. Some experts believe that the biggest need for vitamin E is during the so-called 1,000-day window that begins at conception, since vitamin E impacts early stages of neurological brain development, and that it can only happen during this one specific period. Because of this, it's recommended that pregnant women, nursing mothers, and children up until the age of 2 take a natural, food-based supplement and make sure they're getting enough vitamin E to prevent abnormalities. Most people aren't aware that vitamin E is a collective description for 8 compounds, 4 tocopherols and 4 tocotrienols. Getting enough vitamin A seems to be especially critical for the very young, fetus or infants, the elderly, and women who are or may become pregnant. According to the USDA, the recommended daily allowance for collective vitamin E is 15 milligrams per day, or 22.5 international units for adults. Some foods high in vitamin E are sunflower seeds, almonds, hazelnuts, wheat germ, mango, avocado, butternut squash, broccoli, spinach, kiwi, and tomatoes. There are 8 major isomers of vitamin E. Most of the health benefits described come from the studies involving only the form of vitamin E called alpha tocopherol. Recently, researchers have focused more attention on other forms of vitamin E, with particular focus on tocotrienol, which some consider to be the 21st century vitamin E. Alpha and beta tocotrienols have been found to be the least active forms overall, while delta and gamma tocotrienols are the most active. Recent findings suggest that it's not that alpha tocopherol is harmful, but it may interfere with the absorption of other forms of vitamin E, including other tocopherols and tocotrienols that are needed for heart and cognitive health. Vitamin E is actually composed of two structurally similar compounds, tocopherols and tocotrienols. Each compound is comprised of 4 components, each of which has a distinct molecular structure. Each component is referred to as an isomer, or vitamer, of vitamin E. Each isomer of vitamin E has unique properties, health benefits, characteristics, and attributes, with important application when formulating food and beverage products. Steps are being taken to educate the public about the benefits specifically associated with tocotrienol isomers, which include protection against a wide range of common chronic diseases due to having unique antioxidant and anti-inflammatory potential. Tocotrienols have also been found to have anti-cancer and anti-tumor abilities, lipid and cholesterol-lowering effects, and protective effects that impact the brain, neurons, cells, and the immune system. Regarding the type of vitamin E in your diet, it's best to get a variety of vitamin E isomers from your food, given that different types have different benefits. Tocotrienols have proved to contain some exceptional benefits that are not shared by other forms. Today, the brightest spot for tocotrienol research is in chronic conditions like cardiovascular disease, metabolic syndrome, cancer, osteopenia, and osteoporosis. Sources of tocotrienols are not widely available or popular in most people's diets. However, these include annatto seed, coconut, barley, or commercially extracted palm oil and rice bran. It's best to obtain vitamin E naturally from foods rather than getting synthetic vitamin E from low-quality supplements or processed foods, which is usually in the form of either gamma tocopherol or alpha tocopherol. The vast majority of synthetic vitamin E found in supplements is not the type that's actually found in nature and not necessarily helpful for preventing disease and boosting health. That's why the best way to get vitamin E benefits is by consuming natural vitamin E foods. Most food sources in the typical person's diet are high in vitamin E isomers like gamma tocopherol and to a lesser degree alpha tocopherol. This is especially true of oils derived from major crops like soybean, corn, cottonseed, and sesame seed, which provide about 80% of the vitamin E isomers that most people in the United States get in their diet. These oils contain between 3 to 5 times as much gamma tocopherol as compared to alpha. It's harder to get tocotrienols from your diet, as sources are far less common or available. The Linus Pauling Institute recommends aiming for small amounts of tocotrienol vitamin E, nearly 140 milligrams per day, with an average effect dose for the immune protection and other benefits considered to be between 200 to 400 milligrams per day. The recommended daily allowance for vitamin E, including different isomers, according to the USDA, includes the amount that you get from both the food you eat and supplements. The daily intake is measured in milligrams or in international units. For children, it's 6 milligrams per day or 9 international units. For women aged 14 and up, it's 15 milligrams per day or 22 international units. For pregnant women, 15 milligrams per day or 22 international units, and breastfeeding women, 19 milligrams per day or 28 international units. For men aged 14 years and up, it's 15 milligrams per day or 22 international units. The tolerable upper intake level is the highest amount of vitamins that most people can take safely. These doses can be used to treat vitamin E deficiency, and it's important to speak to a doctor before taking more than the upper intake limits. For someone aged 1 to 3, it's 200 milligrams per day, or 300 international units. For someone 14 to 18, it's 800 milligrams per day, or 1,200 international units. And for someone 18 years and over, it's 1,000 milligrams per day, or 1,500 international units. Vitamin E deficiencies, meaning an intake of all isomers, have long been thought to be rare, and when they happen, it's commonly believed that it's almost never caused by a poor diet. However, some experts believe that many people today are actually not getting enough vitamin E from their diets in natural form, especially too little tocotrienols. There are specific situations that may lead to a vitamin E deficiency due to malfunction in terms of how nutrients are absorbed. A premature infant who's born weighing less than 3.5 pounds is in danger of a vitamin E deficiency, but a paediatrician who specialises in the care of newborns will typically evaluate the nutritional needs of an infant to help spot and treat this early. People with fat absorption problems, which is a common problem for those who struggle with inflammatory bowel disease, may also struggle with vitamin E deficiency in some cases. People who have an issue with their dietary fat levels are at an increased risk because, as mentioned above, fat is needed for the absorption of vitamins. This includes anyone who's being diagnosed with cystic fibrosis, has had a gastric bypass surgery, or people with malabsorption problems like Crohn's disease, liver disease, or pancreatic insufficiency. Deficiency symptoms include loss of muscle coordination and impaired vision and speech. Vitamin E benefits most healthy people when taken by mouth or applied directly to the skin. Most people do not experience any side effects when taking the recommended dose, but in high doses there are adverse reactions that have been recorded. Vitamin E may be unsafe when taken in very high amounts, especially for people who have conditions such as heart disease or diabetes. If you suffer from these health issues, don't take more than 400 international units per day. Some studies show that taking high doses of vitamin E, which is between 300 and 800 international units per day, might increase the chance of having a serious stroke, called a hemorrhagic stroke, by 22%. One serious side effect of too much vitamin E is an increased risk of bleeding, especially in the brain. Supplementing with very high levels of vitamin E could potentially lead to health concerns like heart failure in people with diabetes, worsening of bleeding disorders, increasing the chance that head, neck and prostate cancers will return, increasing bleeding during and after surgery, and increasing the chance of death after a heart attack or stroke. One study found that vitamin E supplements can also be harmful to women who are in early stages of pregnancy. Women who took vitamin E supplements during their first 8 weeks of pregnancy showed an increase of congenital heart defects. Higher doses of vitamin E can also sometimes lead to nausea, diarrhea, stomach cramps, fatigue, weakness, headache, blurred vision, rash, bruising and bleeding. Topical vitamin E can irritate some people's skin, so try a small amount first and make sure that you don't have a sensitivity. Vitamin E supplements can slow down blood clotting, and when you use medication that also slows blood clotting, you may increase the chances of bruising and bleeding. Some medications that slow clotting include aspirin, ibuprofen, and warfarin. Warfarin, or Coumadin in particular, is used to slow blood clotting. Taking vitamin E with warfarin can increase your chances of bruising and bleeding, so be sure to have your blood checked regularly in order to regulate your dosing. Medications that are used for lowering cholesterol may also interact with vitamin E. It's not known if taking vitamin E alone decreases the effectiveness of some cholesterol-lowering medicines, but it does seem to affect cholesterol when taken with beta-carotene, vitamin C, and selenium. Vitamin E benefits the body by playing the role of an antioxidant. As a fat-soluble vitamin, its benefits include its role in proper functioning of many organs, enzymatic activities, and neurological processes. Vitamin E is a collective description for 8 compounds, 4 tocopherols and 4 tocotrienols, and they provide different benefits. It's best to get a variety of vitamin E isomers from your diet, given that different types have different benefits. Vitamin E's benefits include balancing cholesterol, fighting free radicals, preventing disease development, repairing damaged skin, thickening hair, balancing hormones, helping PMS symptoms, improving vision, helping people with Alzheimer's, potentially lowering cancer risk and improving the effects of medical treatments, and boosting physical endurance and muscle strength. It's found only in plant foods, including certain oils, nuts, grains, fruits, and wheat germ. It's also available as a supplement. Some of the top vitamin E foods that you can eat include sunflower seeds, almonds, hazelnuts, wheat germ, mango, avocado, butternut squash, broccoli, spinach, kiwi, and tomato. Vitamin E benefits the mother and child during pregnancy also, and is a vital vitamin for growth and development. Vitamin E deficiencies can include loss of muscle coordination and impaired vision and speech. It may be unsafe when taken in very high amounts, especially for people who have conditions like heart disease or diabetes. If you suffer from these health issues, you shouldn't take doses of more than 400 international units per day.